Grognet from the ACE Academy for Canine Educators. If you want to protect your dog from diseases, the first thing to look at is what vaccines do I need? The two most important ones for sure, canine distemper and canine parvovirus. These ones are standard core vaccines that every dog should have. So make sure you have that before you go to the dog park, which brings up the topic of puppies. If you have a puppy and you're going to be vaccinating your puppy, the protection occurs 2 weeks after the last vaccine. In other words, if you have the last vaccine at 16 weeks, your puppy is protected at 18 weeks old. You do not want to take your puppy to the dog park before that time, because if those diseases are there and the immunity isn't built up, your puppy can die. The last thing you'd ever do is take an 8 or 12-week-old puppy to the dog park. It's just too dangerous. Now, the other vaccines you can get, of course, are Bordetella. Bordetella is also called canine cough, and that one is easily transmissible from dog to dog. And where I live, we see it going through the dog parks generally 2 to 3 times a year. We get these little mini outbreaks. And by doing the vaccine, we can minimize the disease. Thankfully, it's not a fatal one, but we do see it commonly in my area. Now, the other parts of that are parainfluenza, and in some cases you may want to look at canine influenza, but that was a special one and best to talk to your veterinarian about. The other ones to look at are Lyme disease. Lyme disease is carried by ticks, and the best prevention against Lyme disease is combing your dog and getting the ticks off before they have a chance to embed and start sucking blood, using the tick preventive, and there's several insecticides you can use for that purpose. And then last thing, of course, is looking at getting the Lyme disease vaccine. Your veterinarian will know if you have a problem in your area and should be looking at getting the vaccine done or not. And then there's other vaccines such as leptospirosis. That's specific for areas. Not every area has that disease. But if your dog is going and contacting water where other dogs or other wildlife may have urinated, they can pick that up there. And then the last one, of course, is rattlesnake vaccine. That only works against one particular snake, and that's the diamondback rattler. And so therefore, if that snake is a problem for you, you may want to look at getting the vaccine. Its efficacy with other snakes hasn't been proven, so we're not really sure on that one. Again, talk to your veterinarian because they'll know if they're seeing snake bites in your area and if the vaccine will work. The other things they can pick up at the park or being in contact with other dogs are lice. Now, lice are just little tiny bugs that live on the skin surface in the hairs, and if you have 2 dogs just brushing against each other, that can transmit the lice from one dog to the other. Thankfully, very easy to treat and quite easy to spot. So that's an easy one. Fleas, if you live in an area that has big flea problems, and of course it's the warm months, keep your dog on some flea preventive. And that way you're not going to go to the dog park, pick up fleas, bring them home, and they infest the house. So work on that. There's also another mite that you need to keep in your mind, and that's the one for scabies. It's also called Sarcoptes mange. And that one is transmissible, but generally it's more in a kenneling situation, and we don't see it very often at all being transmitted through dog parks. And then one, certainly a vaccine that you must consider is rabies. Rabies, it depends on the area you live in as to the requirements. Some areas require that dogs and cats get vaccinated on a periodic basis, so look into the guidelines of the area that you're living in. If that's a requirement, get it done. If it's not a requirement, find out if rabies is a concern in your area, and then talk to your veterinarian about getting that vaccine done. The rationale for that one, of course, is that rabies is the only disease that your dog can get that you can die from, and it's transmitted through the saliva in a dog bite. So that's where it's going to be a worry for you. One last thing to look at when going to the dog park is worms. And worms are the little guys that live in the intestines of dogs. And these guys can be picked up if a dog goes out and starts munching on grass, because that's where the larvae go. The dogs pass them the eggs in their stool, they hatch, they get onto the grass stems, go up to the top, and wait. And then dog comes along, eats that, and that's how it gets back to the intestine. So if you ever hear that old tale that, oh, if a dog's eating grass, it has worms, it's actually the other way around, and that is, if a dog's eating grass, it's probably going to be picking up worms, therefore should be treated. So if you're using a flea preventive that also gets worms at the same time, and some of them do that when you give it every month, or the heartworm preventives, that type of thing, then there's no problem whatsoever. You're covering that. And that brings up the last thing, heartworm. Heartworm isn't something that's contagious from dog to dog because it's carried by mosquitoes. So you don't have to go to the dog park to have heartworm as a risk. But the main thing is whether or not heartworm is a problem in your area. Again, your veterinarian is the best resource here. Ask them, do they see heartworm? Should my dog be on preventive? So that's it for hazards at the dog park that your dog may be getting into. Just make sure your dog is vaccinated and is on parasite prevention. If you want to see more webinars just like this one, please sign up for them at www.dogtraining.academy, and we'll be glad to add you to the list. So for now, take care of your dogs.